Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, diabetes is a common condition that affects people of all ages. There are several forms of diabetes. Type 2 is the most common. A combination of treatment strategies can help you manage the condition to live a healthy life and prevent complications. So, to discuss on the topic, we have with us today Dr. Pranab Pathak, consultant diabetologist from Nemcare Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, today the topic which we have taken is to know about the diabetes and its complications. So, my first question to you would be, diabetes is increasing globally. So, what could be the probable causes of increasing diabetes or risk factors of diabetes?
Hello everyone. Diabetes is increasing globally and India is a diabetes capital. We know that the number of patients with diabetes is alarmingly increasing, and it is mainly attributed to the unhealthy lifestyle, and some patients do not do regular exercise, they follow a sedentary lifestyle. Then there are some risk factors also which may be associated with diabetes, especially for patients who have a strong family history of diabetes, their parents are diabetic, or for example, patients do not do regular amount of physical activity, then there may be associated other diseases which go hand in hand with diabetes, such as hypertension, dyslipidemia. All these are can be also increasing risk factors. Then again, some factors such as increasing weight or obesity also puts an individual at a greater risk of developing diabetes. So it is very necessary to understand what are the signs and symptoms of diabetes, and if the patients are at increased risk of diabetes, then they should consult with their physician on a regular basis. These risk factors have to be monitored, and these risk factors have to be kept in mind, and appropriate steps have to be taken so that we can check, or we can rather prevent or reduce the incidence of diabetes, which is increasing day by day.
All right. Now, do all patients with diabetes suffer from complications, doctor? They also have some symptoms they occur sometimes, so that the patient's attendants could come to know that the symptoms are prevailing and they should immediately go and see a doctor?
Regarding complications of diabetes, it is not that anyone who has diabetes will end up with complications. Complications usually occur in those category of patients where the sugars remain on the higher side, those who have a higher HbA1c, or those patients where the fasting blood glucose or the 2 hours postprandial blood glucose remains high. These are the kind of patients who have an increased risk of suffering from complications. Now, it is to be kept in mind that not all patients who develop these complications develop any symptoms. There are sometimes patients who will end up with complications, but they will not be aware of. They may not manifest any signs and symptoms. However, if they do have any signs and symptoms, the symptoms are usually related to the organs or the system of the body which is involved. For example, they may have blurring of vision, they may have burning and tingling sensation of the feet, then they may have some associated complications such as weakness, tiredness, chest pain. So sometimes patients may have some specific symptoms, sometimes patient may have some non-specific symptoms, sometimes they may not manifest any symptoms. This again differs from patient to patient. Every patient is different. So it is very necessary for the physician to take a proper history and a proper detailed examination, which will make him understand the problem which the patients are facing, and thereby if they do develop any of the complications, then these complications needs to be treated immediately, and steps needs to be taken so that we can reduce the progression of complications if complications have already set in.
Okay. Now, what are some of the common complications of diabetes, doctor?
Complications of diabetes can be basically divided into two categories. They may be acute complications or they may be chronic complications. Now, acute complications usually occur in those category of patients where the blood sugars become very high. The patient may suffer from very high blood sugars, and there is a condition which is known as diabetic ketoacidosis, where the patient requires immediate treatment. These patients may also require treatment in intensive care unit. And there is also another entity which is known as the hyperosmolar hyperglycemic status, HSS, where the sugars become very high. The patients will have a high sugar and may require immediate treatment in emergency ward or in an ICU setup, and the sugars have to be brought down. At the same time, it is also necessary to understand that there may be some associated infections which may trigger the development of such high blood sugars or glucotoxicity. So proper history has to be taken, and we have to keep in mind that these acute complications have to be dealt very, very immediately.
Now, doctor, there are lots of advice, of course, the patients will need at this point in time. So what advice do you give to patients regarding low blood sugar? Because sometimes patients say that sugar has dropped down. So what could be the reason behind that? What would you like to tell?
There are some category of patients who may suffer from episodes of low blood sugar, which we refer it to as hypoglycemia. Now, hypoglycemia is a condition in which there is a reduction in the blood glucose level. The patients may manifest with low blood sugar, and this usually occurs in those category of patients who do not take meal in the proper time, or who try to skip meals, or there is a very big gap in between the meals. So these are the kind of patients who may suffer from episodes of low blood sugar. And also for patients who are having diseases of the kidney, diseases of the liver in severe form, are also vulnerable to suffer from hypoglycemia. Now, not all patients do suffer from this hypoglycemia. This again will vary from patient to patient, the severity of the hypoglycemia. But some of the important signs and symptoms which usually occur with hypoglycemia, such as increased thirst, then there may be a dryness of the mouth, then there may be associated sweating, tremor, palpitations, and sometimes even patient may not manifest any of these symptoms also. So it is very necessary to make the patient understand about the sequence of hypoglycemia, and they should have a glucometer with themselves so that they can monitor their sugars whenever they feel dizzy, or whenever they feel that they may suffer from hypoglycemia or any of these symptoms develop.
All right, doctor. Now, heart diseases are increasing even in the young adults too. So why is it so, and how to prevent? Is it because of the lifestyle which people are leading? What is the reason behind it, doctor?
Heart disease is increasing in younger adults. We are getting a lot of messages, and a lot of young adults are now suffering from heart attack or heart diseases. Some of the important causes which are attributed to is, one of course is a genetic factor that we cannot deny, but most important, unhealthy lifestyle is one of the most important factor which is predisposing to increased chances of heart attacks in younger adults. Patients do not do exercise regularly, and they will also take a lot of junk food or a lot of easily available processed food, or they will take too much of fast food, and not maintaining proper timing with the food is also very important factor. Increased incidence of patients who are having a dearranged lipid profile, especially high cholesterol, predisposes them to develop atherosclerosis, and this in turn may cause blockage in their arteries, and thereby the patients may suffer from episodes of heart attacks. Also, increased incidence of smoking as well as excessive alcohol consumption are also considered to be important risk factors which are contributing to increased chances of heart attack in young adults. Plus, heart attacks in young adults may also occur because of the increased cholesterol level, increased dyslipidemia, patients adopting a sedentary lifestyle, not exercising regularly, and one more important factor which really needs special mention is the increased level of stress and anxiety in any form, which can also go a long way in predisposing a patient to develop heart attack. So these younger adults should take extra care, they should be extra precautious so that they do not land up with any heart disease in their life.
Okay, now kidney diseases and eye problem also gets aggravated in diabetes. So what is your opinion on this? How to take a check on this, or how to control it?
Kidney problems can with heart disease. As I've already said, that kidneys are organs of the body, and for patients in whom the blood sugar is not under good control, they are at increased risk. Patients having uncontrolled blood sugars, uncontrolled lipids, increased blood sugar level are at increased risk of developing kidney disease. It is necessary to monitor their renal profile. The patient should be advised to go for monitoring the renal parameters such as blood urea, then serum creatinine, which can give them an idea about their renal status. Also, the eGFR has to be measured, and the patients may also suffer from kidney problems because of these uncontrolled blood sugars, which is known as diabetic kidney disease, diabetic nephropathy. Now, diabetic nephropathy, when develops, the patient should consult a nephrologist along with their dietitian, and also because a proper diet is very much necessary so that the kidney problem does not aggravate. They should consult their physician and the diabetologist or endocrinologist, and also take appropriate advice from the nephrology point of view, because if this diabetic nephropathy progresses, then a stage may come when the patient will end up in severe form of the disease, which is known as the end-stage renal disease. And there are some patients where when they develop this end-stage renal disease, they may even require dialysis or a renal transplant, which again is very costly and which also has a lot of complications.
Well, doctor, sometimes it seems that some diabetic patients suffer from sexual dysfunction also. So what advice you suggest to couples who have this issue as well?
Patients who may develop sexual dysfunction in diabetes. Again, this sexual dysfunction in diabetes can occur in both male and female, especially patients who have uncontrolled diabetes, patients who may have diabetes uncontrolled for a very long duration of time. Most of the patients usually do not speak out very clearly about these sexual disturbances or sexual dysfunction which they. But when we counsel the patient and when we take a proper analysis or when we take a detailed history, then these patients speak up and they tell to us about their sexual dysfunction which they suffer, like there may be associated loss of libido or reduced libido, then there may be erectile dysfunction, of interest in sex, or there may be associated some other sexual disturbances which can occur, and thereby it sometimes can also affect the relationship between the husband and wife. So the sexual disturbances or dysfunctions do occur, and therefore when we counsel the patient and when we take a proper history, we can get an idea about this problem which they are facing, and there are appropriate medications for that, and is very much important that we have to counsel the patient about the sexual disturbances and how they can tackle it so that they can have a productive life.
It's time now to slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the Health Show with me, Pooja, and we are having a fruitful discussion with Dr. Pranab Pathak on diabetes and its complications. Now, foot problems have always been related to diabetes. We have heard about it regarding the foot problems. So how to prevent or tackle with diabetic foot-related issues? What would be the issue related to? What are the things that has to be taken care of?
Now, foot is another important organ which is very vulnerable to injury, and therefore it is very much advisable to diabetic patients that they do take proper care of their feet. It is necessary that they have a proper footwear, and at the same time they should also take a proper foot care. Any small ulcer, if it is present, should not be neglected, because it is sometimes seen that the small ulcers can grow in size and they may become infectious, and sometimes they can take a severe form of the disease where there may be associated lack of blood supply, there may be associated gangrene, and the infection may reach to such a state that the patient may have to lose a part of the limb or amputation had to be done. This will be very agonizing for the patient. This will be very stressful for the patient to lose any part of the limb which could have been prevented if proper and timely treatment and care had been taken. So any small ulcer which is there should not be neglected, and patient should not do any home surgery in their home. They should consult their doctor on a regular basis, and they should wear appropriate footwear. They should not walk barefooted, and this usually occurs in patients who have uncontrolled diabetes.
All right. Now, doctor, what is the right time, when is the right time to see a healthcare provider? Because a patient must have a confusion in their mind. When is the right time to see a doctor? Because there are a lot of kits available nowadays at home. They keep a check on their sugar level at home itself. So when they see the numbers are fluctuating, so when is the right time to see a healthcare provider?
If you are to ask me when is the right time to see a healthcare provider, first of all, this again will vary from patient to patient. If you manifest any or if you experience any of the signs and symptoms of hypoglycemia or hyperglycemia, then you should consult your doctor immediately. If you have any infection, if you have any non-healing wound, or if you have any symptoms such as increased thirst, increased urination, increased hunger, then maybe diabetes has started to develop, and therefore you should consult your doctor. Also, sometimes, as I've said, that patients may not manifest any symptoms. So if you have any of the risk factors such as you're overweight, you're obese, or you have a strong family history of diabetes, your parents are diabetic, then I think a yearly checkup with your doctor is very much advisable so that you can know your sugars. And most importantly, the patient should monitor their blood sugars in their home. They should have a good glucometer, and along with blood sugar, it is also necessary that they take proper care of the blood pressure and the cholesterol, because controlling the blood sugar alone will not be sufficient. If you are having hypertension, if you have been prescribed any medicines, then you have to take the medicine on the right time. If you have a high cholesterol and you are prescribed medicines, you cannot stop the medication without the advice of the physician. Every advice which has been given to you, you must follow it sincerely, and you need to consult your doctor when you manifest any symptoms or if there are any associated risk factors which may be related to diabetes.
Okay. How important is diet, doctor? As regarding managing diabetes, we have seen the erratic lifestyle of several peoples nowadays because of the busy schedule they are leading these days. So on diet part, what do you have to say?
Diet plays a very, very important role in managing diabetes. We know that medications may be required for some patients, but it is equally important that patients should also have a good balanced diet. That is why we advise most of our patients to take help of an experienced dietitian, because an experienced dietitian can guide the patient about the level of calories which they require or which their body requires, and therefore they can give a well-balanced diabetic chart, a diet chart containing appropriate amount of carbohydrates, vitamins, minerals, proteins in correct proportion, so that they can know an idea as to how they should plan out their entire meal pattern. There are some patients who have a very erratic meal pattern or who may not take the meal in the right time. If you consult your doctor, if you consult your dietitian, they will be very much ready to guide you about the diet which you need to take and about the calories as per your body requirement. Because there are a lot of patients who take extra amount of calories which puts on more weight, which leads to obesity, which leads to overweight, and can also increase the risk of diabetes and other disease. So it is very necessary for the patient to know the level of calorie which their body requires, and the dietitian can give them a customized diet chart. Every patient is different, so based on his likes and dislikes, and the dietitian will give a healthy, nutritious, balanced diet which the patient should follow, and this managing diet can be of great help in managing diabetes as well as associated other diseases such as hypertension and dyslipidemia.
All right, all right. Now, doctor, what is the role of exercise in managing diabetes? What would you like to say on that?
Now, exercise is also one more important factor which also needs to be kept in mind. Now, as I've already said previously, that those patients who are having a sedentary lifestyle, those who do not do regular physical activity, those who do not exercise regularly will put on weight, they will be obese, and therefore they will suffer from diabetes, or they will be suffering from other diseases of the heart, the kidneys, increased cholesterol. So that is why it is very much necessary that patients should do regular amount of physical activity. Now, this physical activity, there are different types of physical activity. There may be either walking, skipping, jumping, cycling, swimming, whatever the patient feels comfortable, or whatever the patient feels that suits him or her, the patient can do that level of physical activity. At least 30 minutes of walking for 5 days a week is recommended, but any form of physical activity based on his time can get. If you are not getting time in the morning, you can do in the evening hours as per your routine schedule. You can plan out your level of physical activity, and then you should do regular amount of physical activity. So doing good amount of physical activity along with maintaining a good balanced diet, and most importantly consulting your physician on a regular basis, can help in reducing the incidence of diabetes. And especially I want to point out one thing, that there are some patients who are pre-diabetic, who are at increased risk of developing diabetes. They have not developed diabetes now, but they are having chances of developing diabetes in near future. So for them, lifestyle modification is very much required. They have to do eat a well-balanced diet, they have to do regular amount of physical activity, and at the same time it is also mandatory that they should consult their physicians on a regular basis.
All right, we are really short of time, so what message you would like to give our viewers who are watching our show at this point in time, Doctor?
So my message to the viewers is that if you are suffering from diabetes, don't get depressed. Diabetes is not the end of life. You can still lead a healthy life. Only thing is that you have to understand the disease pattern, and you have to maintain your blood sugars under control. Along with that, if you are having issues of hypertension or dyslipidemia or increased cholesterol, that also has to be taken care of. Maintaining a good blood sugars, keeping your HbA1c under good control, and keeping your blood pressure under control, and also reducing their cholesterol will be very much effective in reducing the progression of diabetes. For patients who are pre-diabetes or who have not developed diabetes, you need to make lifestyle modifications so that the patients who are pre-diabetic do not transform into full-blown diabetes in near future. Along with that, it is very much necessary that if you have developed any complications, then proper and timely treatment of the complications is very much required. Proper diet is required. As I've already discussed, you need to consult with your doctor regarding a diet, and you have to do a regular amount of physical activity. So diabetes management has to be done, and the patients should also reduce the level of stress, because stress itself can also aggravate problems of diabetes and hypertension. Along with that, I would like to mention that you also need to have a good amount of sleep. Not only a good quality sleep, but also a good quantity of sleep. So you have to have a good amount of sleep so that your body can get sufficient amount of rest, and you have to also be in a positive frame of mind. So my advice to all the viewers is that you need to consult your physician on a regular basis. Stay safe, stay healthy, and keep smiling. Thank you.
All right. Thank you so much, Doctor, for joining to Good Life, the health show, and giving those valuable messages. I'm sure the viewers who have watched our show must be benefited with the answer just Doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.